Say goodbye to thigh pain forever. Is the femoral nerve the secret to your anterior thigh pain that you never knew about? Have you ever experienced anterior thigh pain that you could not explain? And you may have searched for videos online to understand what's going on with your anterior thigh pain, and you keep running into all these videos for things like sciatica, but then they're talking about the fact that it only goes down the back of your leg, and you're like, no, mine goes down the front of the leg. That's actually how this video came to be, is that I had several people comment on my sciatica videos and say, well, could my sciatica be down the front of my leg? Well, no, it can't be, but there is another nerve that runs down the front of your leg. I would like to introduce you today to the femoral nerve. The femoral nerve starts in the lumbar spine. So in the lumbar spine, there's 5 lumbar vertebrae, numbered 1 through 5. And the femoral nerve actually comes from the nerve roots that come out from the side, L2 through L4. And so these nerve roots come out from the side and then they mix up together and form all kinds of different nerves. But today we're going to talk about the femoral nerve. Once it's joined together, it travels through the psoas, or the hip flexor. So that's the muscle that helps bring your knee up in the air, like when you're marching. Then it goes underneath the inguinal ligament, which is super important because if you have a pelvic malalignment issue, that can be putting pressure on the femoral nerve. And then it travels down into the quadriceps and innervates those as well. Innervates means helps them to work correctly. Now, it's really important because the femoral nerve actually does sensory as well to the front of the thigh and the inside of the thigh, as well as down into the calf. And the sensory is important because that's numbness and tingling. So you may have numbness and tingling as opposed to pain, and it can still be that femoral nerve. Whereas you may have pain and numbness and tingling, and all of that together is the femoral nerve. The common symptoms that occur with a femoral nerve issue can potentially be pain or weakness in the quadriceps and the hip flexor. And it can also be sensory changes that affect the anterior thigh, the inside of the thigh, as well as down into the calf. Sensory changes would be things like that numbness and tingling that you're feeling along that pattern. So how does the femoral nerve get damaged or squeezed or compressed or start causing problems in the first place? Well, it's important to know at what point along the chain it's actually getting irritated. So it starts from L2 through L4 nerve roots, which means it could be getting compressed at the nerve root level, and that's causing those symptoms that are going down into your thigh. Next, it travels through the psoas muscle, which means it can be getting compressed or squeezed as it goes through the psoas muscle, which could also be causing symptoms down into your thigh. As we follow along the femoral nerve pathway, it travels under that inguinal ligament, which can get tight and can compress the femoral nerve, causing symptoms in your anterior thigh. And it does travel through the quadriceps. So if you get a contusion or a bruise that's big enough on your quadriceps, that can actually affect the femoral nerve too. That is definitely less common because the femoral nerve travels pretty deeply through the quadriceps, but a big enough bruise could make it happen. Now, I will say in today's society, I tend to see less femoral nerve issues, but when I started my career so long ago, I gotta say I definitely saw more of it. What has changed over the past 20 years that would cause us to have less femoral nerve issues now than we used to? You might be surprised to find out that the answer is our waistbands. So 20 years ago, we used to have lower waistbands, and definitely 10 years ago, those really low waistbands, they would be so low that they would go over the pelvis right where the femoral nerve was. And then people would sit down in their tight waistbands, which would cause more compression to that femoral nerve and lead to a lot of anterior thigh pain. So nowadays we tend to have higher waistbands. More people tend to wear things like yoga pants or more stretchy pants, and we tend to see less anterior thigh pain. But that's something for you to think about. If you're like, hey, I started wearing these new pants and I've started having this anterior thigh pain, it could be happening to you still. So think about that. Have you changed anything in your wardrobe recently that could be putting compression on that femoral nerve? Because let me tell you, that would be a super easy fix. Now I know, most likely it's probably not that you're wearing a low-cut, tight waistband, because that tends not to be the style these days. And that's why it's really important to work with a manual physical therapist who can help you understand exactly what the root cause of your pain is. Because just because you know it's a femoral nerve, you don't know at what aspect it's getting compressed or squeezed. And yes, it can be more than one. But how do you know if you should be stretching your psoas or stretching your quads or doing this or doing that if you don't know what the root cause of it is? And I understand that that's the frustration with things like YouTube videos, is that people say, oh, you should do this, but they don't know your root cause. And until you know your root cause, you truly don't know how to solve the problem. I can say that it's really important to find a specialist to work with to understand the root cause of your symptoms, because femoral nerve pain can be obviously a pain in the front of the thigh, but it can lead to long-term issues over time. It can affect motor function in the anterior thigh, which can cause compensations in the long term. And you don't want to let it get to that point, because that becomes more difficult to unravel. If you found this video helpful or learned something new, I would really appreciate you booping that like button, because that helps that algorithm. And don't forget to subscribe for more health-related content.